Hey, everybody. Welcome back to the Healthy, Wealthy, and Smart podcast. I am your host, Dr. Karen Litzy, owner of Karen Litzy Physical Therapy, located in New York City. And on today's episode, we are going to be talking about the APTA's research agenda. So I'm thrilled to have back on the podcast Dr. Stevens-Lapsley. She's a professor and director of rehabilitative science PhD program with the physical therapy program at the University of Colorado School of Medicine, and Dr. Kory Zimney. He is an associate professor within the Department of Physical Therapy at the University of South Dakota and the director of the PhD in Health Sciences program at USD. Both Dr. Stevens-Lapsley and Dr. Zimney are members of the Scientific and Practice Affairs Committee with the APTA and were involved in the development and publication of the most recent physical therapy research agenda. So welcome back, both of you, to the podcast. Happy to see you again.
Yeah, thanks, Karen.
Thank you for having us.
Okay, so we're talking about the APTA research agenda, and we've talked about this a little bit. I'm wondering how many members of the APTA even know that there's an APTA research agenda. So before we get into what the agenda is, can you talk a little bit about why it exists?
So research agendas have consistently helped direct the focus and prioritize targets. So just like targeted funding opportunities drive more research in key areas of focus, the research agenda is also intended to try and get direct traffic, into key areas. And in many cases, you may have a research trajectory if you're in academics and you have funding, or if you're in a clinical setting, you may have a patient population that you work with, that you're participating in research. And you may be able to pivot slowly over time or quickly in some cases, so that you can better address things that are maybe more meaningful and more time sensitive. So it basically serves as a roadmap kind of to just help us focus on target areas that are of importance. And it's important to emphasize that these agendas really are not only intended for clinicians, for researchers, but also for clinicians. And we may be able to chat a little bit more about that piece later.
Yeah, we'll definitely get into why clinicians should care about the research agenda. But before we get to that, we're going to back it up. So now we know the why, but how does this process happen? Like, what is the developmental process for generating this research agenda? Kory, I'll shoot it over to you first.
Yeah, so the process, like I said, the very first agenda was back in 2000. The second one came out in 2011, and there was never really a home for it. And so originally it was just therapists and researchers that came together, created it. A little over 10 years later, a group of researchers kind of got together and said, geez, we probably should update this. And then APTA, just as it's continued to evolve and grow and prioritize things, it kind of moved and it created this idea of what Jen and I are involved with, which is the Scientific and Practice Affairs Committee. And so that actually then they decided that would be the home to start, developing this research agenda and keeping it current. So it kind of has a home now, or at least that's the intended plan. And so actually we started a couple of years ago to where we looked at the previous agendas, as a group. From that, then we started to create, where we thought changes would be. We sent it out to all sorts of different stakeholders, so like different chapter presidents, the different sections and academies, sent it out to them, DEI committees, got feedback from changes that we made, thoughts that they might have. So we took all that information in, made adjustments, asked for new suggestions, sent it back out again. So it was this back and forth kind of iterative process by surveying and synthesizing and creating, and surveying, synthesizing, creating. And then reviewing and getting the final review, and then eventually going through to where it came to its full form, but is now published in the PTJ that we see it. So that's really how that process went. Like I said, just with the number of people and the surveys being sent out, and the time you get it tabulated, and then the time all of us, again, it's just a volunteer thing. And so, taking that time to meet and then to really kind of craft what each of the different areas are and what some of the topic ideas was really almost a 2-year process that we went through to get that developed, what you see today.
Yeah, I was just going to ask that question. How long did all of that take? And the other thing that I'm really glad that you pointed out is that everyone in this committee are volunteers, right? So you're
Yep.
not getting paid. This is volunteer in order to help progress the profession through, let's say, maybe the next 10 years or so. And I think that's really important to mention because, you hear a lot of people who maybe aren't members of the APTA or who are, and they say, oh, is this where my dues are going to? And this person, and it's like, hold on a second here. Because the people involved in this, like you're putting in 2 years of time, of your time and of your brilliance and of your effort in order to help shape what may be research that can help the people that we're all collectively treating.
Yep.
So I think it's really important to point that out. Anyway, I'll step down from the soapbox for a moment. I digress. Okay, so we know why. We know how it was developed. So once something is developed, we like to get it out into the world, right?
Yep.
So you understand why you get it developed, then you have to disseminate that. So, we'll put links to everything in the show notes. So regardless of where you're listening right now, but there's a lot that goes into dissemination. So do you want to talk a little bit about that and what it looks like from from a graphic standpoint, right? Because there's a really great infographic on this. And the time it takes to do that, and then all this other work that you're doing to get the word out.
Yeah, I could kind of start there, and then Jen, you can add in and stuff. And that's really, kind of been some of the issues that we kind of looked at previous agendas. I mean, it gets published in PTJ, and the question, how many people actually get PTJ, how many people actually read it, and actually how many people read that specific article. And we had no measurements of how do we know if people are, using it or not using it. That's always been kind of a negative, you could say, I guess, from past ones. It's, how do we monitor if this is being successful or not, and really evaluating that. And so really, so that's one thing that we're kind of working on now is this, like you said, the dissemination. So, getting on various different podcasts, because we know that's a place that people access information now. So we're hoping that's beneficial. We hosted a session at CSM this year, potentially again next year. And so really looking at that, we're actually partnering more with the Research Academy so that academy gets a little bit more involved in the whole process. And so really just trying to be open to those different areas that we can try to get the information out, so that people can understand how to use it. It's not a tool necessarily that kind of like, you get a systematic review and it's like, oh, okay, that's how I should probably treat this because the systematic review says this is the best evidence. And, where this is a little bit probably a different type of thing from a professional development, kind of looking at what are the research questions, what are the ideas that we're looking at moving into, or what questions don't we need to grow deeper in. We're going to talk about clinicians, I know, and how they can get involved in that process, and how do we help younger clinicians or younger researchers develop ideas and kind of not really sure where they want to go to. It's a way to maybe generate ideas. They can read it and say, well, this is interesting, but I'm also wondering about this area of it further. And, so it's not meant to give them the exact question, but highlight some areas of interest and things like that. So hopefully, people that are interested in research, that they're using it too.
Sort of spark some ideas, spark some conversations, things like that. Jen, anything to add to that?
No, I think it was really well covered. I guess I would add, when I look at the evolution of this particular research agenda over time, it's interesting to kind of, when we think about dissemination, we think about how we're going to measure the impact. One of the ways is by just monitoring whether or not research topics and emphasis change, like in terms of citations or maybe CSM abstracts, or, look at kind of content representation. The early research agendas, were much more inward focus. They had much more of a narrower lens and a narrower focus. And so I think we've seen over time our profession has evolved to be open to answering more complex questions. So I think the agenda in 2000 looked primarily at clinical research, with some emphasis on epidemiology and basic science, but not nearly as much emphasis as subsequent agendas put on those areas. Um, and then we moved in 2011 to broader categories. And then the more recent the current agenda that we're discussing, it's not intended to be, well, they're just, the questions are much more complex. And so we can monitor whether or not our science changes, our research changes over time. Do we see more questions being asked in real world contexts? So some emphasis on implementation science. Do we see more questions that have more interdigitating elements that are trying to explain phenomenon that I will kind of highlight as we get into more detail. So, just really kind of providing a broader framework. And I think that's one way we can look at what our impact might be with the agenda, is whether or not we see that shift.
And let's get to the agenda then. So it's sort of organized into 6 key areas. So do you want to go into each area and maybe give an example of maybe what a research priority might be within that area?
Sure. So at a very high level, without kind of, there's a number of specific bullets kind of under each of these 6 areas. But, one of the new areas that was added was population health research. And so population health research is described, you're characterizing, explaining, and influencing the levels and distributions of health within and across populations, such as among individuals and groups, as well as across time and generations. So you're looking at things like health disparities, social determinants of health, global health. And so there's a number of things that fall under that category, but one example is explore the disparities in access to physical therapy services and impact on patient outcomes, just as one of many examples.
Mm-hmm. And
yeah.
do you, as you are kind of talking with physical therapists, you did a session at CSM, do you get any pushback on any of that? Because sometimes you hear people say, and I know this was part of House of Delegates a number of years ago, well, why do we have to care about where people live? What does that matter? Right? How does that affect us as PTs?
Yeah, and we haven't gotten a lot of pushback because I
That's
think
good.
there is an increasing awareness for looking at health disparities, where someone lives impacts maybe access to resources, and care in general. And so I think that's, again, part of the evolution of our profession, that I think there's an increasing awareness of the value. Population health was listed first amongst the list of 6 different sub areas, because I think it does represent kind of the shift in our way of approaching some of these research questions and the prioritization of this particular area.
Yeah. Well, that's good news.
Yeah.
Kory, anything to add on that?
Yeah, no, I think that's, like I said, the population health was one of the new ones. But, it was kind of interesting, like I said, because I think, I remember looking at the research agendas when they'd first come out, but again, it's not something you memorize or anything like that. It's kind of like the code of ethics. You read it, you kind of get the general sense. And, but it was fun going back, as we went through this process, reading through it. And like Jen was saying, that growth of our profession of, that inward look, and now it's that outward look, and that's what the profession's mission statement has changed from that inward, of trying to be doctors and all that. We're that now. It's how do we transform society, and that's where that population health really is. How are we transforming society as a profession, and we need to be the front runners in the research aspect of that. So I think that was just kind of neat going through this process and seeing just the growth of the profession that way. So yeah, I would echo Jen. Yeah, we really haven't gotten that kickback, because I think people are appreciating that we have a significant value as physical therapists to give to the societies that we serve. And to do that, we have to have the research and to figure out what are the best ways that we can do that in.
Yeah, and how to impact people in a much more profound way. So it's nice to see the profession is sort of opening and widening the door a little bit more.
Yep.
So excellent. Okay, so there are 6 key areas. Population health is number 1. What are the others?
So mechanistic research, and that's probably a little bit more intuitive. It's been part of the research agenda, although slightly different titling. But, we included this time more emphasis on things like genetic and molecular and cellular mechanisms, epigenetics, things that are treatment modifiers and biomarkers. So things that reflect kind of the evolution of the science and what we're capable of measuring that might influence responses to physical therapy interventions. So a number of other things fall under kind of that paradigm, but that's kind of a really broad, big picture kind of view of that mechanistic topic.
Okay, that's number 2.
And the third one is one of the bigger buckets, which is clinical research. That can encompass a lot of different things, from safety to efficacy to effectiveness, and a lot of clinical trials kind of fall under that umbrella. But again, you see the things like examine the effects of physical therapy services, frequency, duration, intensity, timing, to address a multitude of conditions, disabilities, injuries, or diseases. And I think that certainly parallels what we have seen in previous agendas, because that clinical research foundation has been such an important part of all our agendas over time. But again, I think you see a little bit more of these implementation science methods and new methodological approaches to identify and reduce unwarranted variation in practice. So a couple of new emerging themes that I think we started to see individuals really study very effectively.
Yeah, and I think that this is the bucket that most people, I would say, are most familiar with, right?
Correct. Yes,
Yeah.
exactly.
Okay. All right. That's 3. Keep it going. What's
Yeah,
next?
so the fourth one is education and professional development research. And this is a really important area of focus that has been, I think, much more greatly emphasized in our curriculum and our DPT programs, because we have to understand, we have all this wonderful research out there, but we have to understand how we're going to get that knowledge into the hands of our students and practitioners who are just coming out of school. And so there's been a large emphasis on trying to develop better methods, whether it's developing and evaluating competencies in programs, or educational approaches that promote learner development and lifelong learning. So really figuring out how are we going to change the educational foundation that we are building our profession on, so that we can take all this wonderful research and apply it now to more of that education side of things.
And does that make education more complicated? So if you guys are both educators, right? So from an education standpoint, does that make it more complicated in that you are thinking, oh, now I have to add more to a curriculum? Or is it, I have to adjust the curriculum, take some things out that aren't serving anymore, and put this in its place?
Yeah, that's where I would see it. I mean, obviously, one of the, we're kind of shifting to some competency-based education, as kind of a movement in um, DPT education. So, it's taking new things like that, but really understanding what are best practices. It's no different than in the clinic. What's the best way to treat an ACL to recover? How do we, like Jen said, how do we get this information in the student's head? What's the best way to be the most effective, most efficient, so that they can learn this, so that, yeah, maybe we can cut out some things in the curriculum. Maybe there's other areas of the curriculum we can get from a learning standpoint, so that students learn it better, so they're less stressed and less anxious, and they're better prepared then when they get into the clinic. So it's really taking those best practices from education, but specifically applying them within our profession.
Yes. And how do people learn best?
Right. Yep. Yeah. I mean,
Right? Okay.
yeah, I think all of us as educators, we think when we teach our students, oh, this is the best way to teach them. But the reality is, yeah, it's just the same as every clinician. You think how you treated that shoulder injury was the best way to treat a shoulder injury. But when you read the research, you're like, maybe that wasn't. And
It's
I
like,
should look at best practices. So it's no different in the educational world too. So
Right, right. Oh, that's thank you for making that distinction between that and like the clinical investigations, because I think sometimes that can get a little muddy.
yeah.
Yeah,
Yeah, and I
perfect.
think I think the more I see in the education world, the more I appreciate the complexity in a good way, like you're saying, tailoring learning to the individual that's in front of you, just like we tailor
Mm-hmm.
interventions to the individuals that are in front of us,
Mhm.
and building on their strengths, right? And
Yeah.
that does require a decent amount of understanding of educational methods, and has quite a bit of complexity that at the surface may not be apparent.
Yeah. It's hard. Educating new physical therapists is hard. And it takes a lot of work. And so this is certainly a bucket that I could see as being very useful for educators within the profession. Okay, population health, mechanistic research, clinical investigations, education, and professional development. What's number 5?
And number 5 is health services research. And CoStar and the work that Linda Resnick's group has done has really elevated the visibility of health services research in our profession. But this again kind of continues to build on much of that. And there's an emphasis on evaluating physical therapy delivered via different care models. So when we look at like concurrent treatment, group therapy, one-on-one, what's best practice, and looking at kind of how those different care models impact clinical outcomes and cost effectiveness.
Mm-hmm.
Health services tends to also ask questions about the impact of physical therapist services, say on downstream healthcare utilization, like what are we doing to potentially prevent costly adverse events, essentially, to our in our patient populations, that we can save the healthcare system money. So lots of questions kind of revolving around those domains.
Mm-hmm. And what's the last one?
The last one is workforce research, and this is also increasingly important to really just understand, things like the impact of administrative burden and productivity requirements on patient outcomes, total cost of care, and the physical therapy providers, like your job satisfaction. We
Mm-hmm.
need to understand how we can create environments where we prevent or minimize burnout, and maximize job satisfaction. So how do we maximize salary and not do it, and also optimize patient outcomes? Reimbursement, is part tied so closely to a lot of what we can do, and how do we figure out how to provide a much more efficient and effective care while still providing high level enjoyment, or creating an environment in which therapists can have high levels of job satisfaction.
Yeah. Kory, anything to add on that?
No, I think, like I said, I think sometimes, like you said, everybody, when they think research, like they said, they go to the clinical, maybe mechanistic, this is how osteoarthritis develops,
Mm-hmm.
but really understanding it's for the profession as a whole. So that's where things like workforce development, how many people do we have? Do we have the right number of therapists? And how are we educating our students? And how does this handle when we're in large systems, when you look at, um, kind of some of the health services research, and how do we fit in the population as a whole? So really, it's that much broader, not just the clinical aspect, but there's a lot more. As we all know, there's a lot more to being a PT than just the
Mm-hmm.
clinical aspects, and that's what this whole research agenda is looking at, all of those things. And social determinants, again, I think some people, we had that discussion a lot within our group. Is that a separate category? And we really decided to weave that pretty much because we felt that is such a key thing now, and we're understanding how important these social determinants are and everything that
Mm-hmm.
we do in all these different areas, that we really kind of wove it into all of the categories, instead of making its own standalone, because it's just something that, I think we're recognizing, obviously societally, professionally,
Mm-hmm.
that these social determinants are so key in so many different things. So that's, kind of a subcategory that's really kind of woven into the 6 areas that we've came up with.
And the thing that I like about the 6 areas, and especially from your description, is that it's not just for researchers. You could look at the population health research, and if you have a private practice, this is going to be important for you because you need to know the population that you're
Mhm.
treating and how best to do that. Or the workforce, whether you are in a big hospital system or you're a small private practice, all of that matters. That research matters
Mhm.
because you want to make sure that you have a happy, healthy workforce and you're not pushing people into burnout. And the health services research, as you were talking about that, it got me thinking, oh, this is a great way to market the profession because we're showing how we're saving downstream costs, or we're showing how the impact we as physical therapists can make can not only make people better, but can save people money, can save the whole healthcare system money versus going into costly, whether it be surgeries or, the Choose PT campaign around opioids, things like that. So I see a place for a lot of different parts of the profession in all 6 of those areas. So that being said, can you guys talk a little bit more about why clinicians should care about this and not just researchers? Or as Kory said, oh, I'm just a clinician. Why should I care?
The thing that bothers me the most, right? If you ever see me at a conference and you say just a clinician, you'll
He
get
will
a
come
rise out
into
of me.
the audience and he will shake you.
And I'll tell you, I'm just a researcher then, and we're all just something, but we're all important. No, I think that's, it was kind of fun at CSM. We had a lot of clinicians, which kind of at least it surprised me when we held the session. I was expecting it to just be a bunch of us researchers talking, but I was really excited that there was a lot of clinicians and saying how they wanted to be more involved. And I think too, especially because so many clinics now, data, we all know the importance of data. You can't run a clinic now without keeping your KPIs and all that kind of stuff. And especially because we recognize more and more systems are getting larger. So obviously there's better data with larger systems. So, you get large outpatient clinics that have multiple clinics. You get large health systems that are collecting this data. So a lot of this health research data, we have that information out there. It's just collating it, pulling it together and stuff like that. So really, it's hopefully sparking a lot of clinicians to think of that because they actually probably in their data sets have a lot of answers to some of these kind of questions that they may not necessarily be thinking of themselves because they're probably thinking of the clinical, oh, I don't know how to run an RCT. I don't do that. I treat a patient all the same. But there's a
Right.
lot of this information that's extremely helpful. And that's where that idea of, think about what you have in your data sets at your clinics. If you're kind of bogged down, I don't know how to run the statistics, get a hold of your local university in the area and talk to a researcher there, and they'll probably be able to maybe assist or at least point you somewhere to somebody and get involved in some of that. Because there's a lot of these areas that, we really need to look at. Even students, if you're taking in students as a CI, what are best practices there? And, if you have different students and you do different things, does one do better than the other? Or get involved and talk to your DCIs at your universities and talk about different methods. So all of these things, again, research, I think, has always been thought of as a subgroup, these researchers over there, but we're an evidence-based practice, we're an evidence-based profession. And so we're bound, we're built upon research. And that's one of the values, I think, of the PT profession is that we always have followed evidence and we've changed and shifted and grown because of that evidence base. And so I think, yeah, the more people we get involved in just thinking about research from that perspective, that we're all researchers, really. Every patient that you see, you have a hypothesis of what you think it is, and you start implementing things to see if it makes changes. So yeah, it's trying to hopefully change some of that culture a little bit.
Yeah. Jen?
Yeah, well, I would reiterate just the fact that we need clinicians to develop our research questions, right? We need a two-way street and partnering and informing. I mean, I've worked closely with clinicians across the country in a variety of different capacities, and want to really empower clinicians to approach academics, come to conferences, ask questions, challenge paradigms, challenge maybe the way a research question is being asked, and help us collectively work together to improve the quality of what we're able to produce. You can't have research done in silos. You really have to have the stakeholders, the clinicians, the patients kind of all involved in developing optimal research questions and research products. So don't sell yourself short if you feel like you're not a researcher and you're just a clinician, because that's exactly the partnership that we need moving forward.
Yeah. So it sounds like what you're saying is to network with your fellow physical therapists and learn from each other. And hopefully, better research will be a product of this networking and collaboration.
Yeah,
And just
absolutely.
start collecting outcomes. Sometimes it's as simple as that we don't have the outcomes on which to build or ask research questions or refine practice. And so I talked to a lot of clinicians who are interested in engaging in research about just start collecting data at your in your clinic, and it's Kory, you kind of alluded to that, like that's a great starting point because it will
Mm-hmm.
also help inform decisions with the patient that's right in front of you, as well as hopefully develop a data set that can be used to answer other clinical questions down the road.
Right, right. Well, this sounds like a very robust research agenda, and I'm really happy that you guys are out here and allowing physical therapists to know that it exists, and two, know that they can be a part of it and that
Mhm.
they can use it to help them inform their decision making or help create new ones. So what would you say? How would you wrap this up? So, Kory, I'll start with you. What do you want the listeners to take away from this discussion today?
Yeah, well, first, Karen, thanks for bringing us on. Like I said, that's just one of our goals. That, like I said, I really enjoyed the process, looking at just how we've grown as a profession and how we've grown in our research with that. And I think that, yeah, I want people to realize that we're all researchers to some standpoint. That there's information and data, and that you can be involved, like Jen said, as a clinician, seeing patients or being involved in a trial or just even asking questions. And so I think pretty much every um, clinic here within states that have multiple universities, there's probably one close to you, is make
Hmm.
connections with them and create that collaboration, so there's not that separation from the institutions to the clinics. That, again, the more collaborative we can be in this whole process, the better our research is going to be and the better it's going to move our profession forward.
Perfect. Jen, how about you? How would you wrap it up?
Well, I think, it's important to emphasize that this research agenda is not static. We've seen
Right.
evolution over time,
Mm.
and there will be future research agendas. And there, as Kory outlined, there's a lot of opportunities for feedback along the way. And as we're developing the next research agenda, and so keep your eyes and ears open for opportunities to get involved. Certainly provide feedback to us if there are suggestions that people have for how to disseminate further, or ideas for how we could track the effectiveness of this particular research agenda. We're open to all those suggestions, but really, yeah, get involved. If you're frustrated about the lack of evidence in some area related to a patient population, there are lots of different ways to contribute to improve the quality of what we're able to provide, whether it's the patient in front of you, whether it's getting additional education, fellowship, residency, PhD training. There's
Mhm.
lots of ways that you can be involved in this process.
Perfect. And where can people find the two of you if they have specific questions? And also just know, again, like I said before, regardless of what platform you are on right now, if you go into the show notes, one click will take you right to the research agenda, infographics, downloadable PDF. But where can people find you if they have any specific questions?
Yeah, so
Probably the
me,
easy,
oh, go
yeah,
ahead, Jen.
go ahead.
Okay. Yeah, the easiest thing, just email me. It's kory.zimney@usd.edu is probably the easiest to access. I do have a Twitter account out there. I don't check that as much because it's changed to X, and those are always things that you
Yeah.
can reach me on too as well. But probably the email is always the easiest and most direct with that too. And then obviously the practice section, we haven't talked
Hmm.
about that. Like I said, the SPAC, is the committee that's been doing it, but that falls underneath the practice section as well at APTA. So they're definitely always available for questions as well and disseminate things out. So
Perfect. Jen?
Yeah, so my email is a little bit of a mouthful. But if you look up the University of Colorado physical therapy program and look up Jennifer Stevens-Lapsley, that's probably the easiest way to track down my
Perfect.
my email address. You're welcome to email me with suggestions and thoughts.
Excellent. All right. So before we sign off, I have one more question. This has nothing to do with the research agenda whatsoever, but you've both been on the program before, so you may be familiar with this. Although, Jen, I don't know if I was doing this the last time you were on. It's been a while. So I'll start with Kory because I think Kory knows what's coming. So it'll
yep.
give you a couple of seconds to noodle on it. So, knowing where you are now in your life and career, what advice would you give to your 20-year-old self?
Yeah, so this is advice I've been trying to give to a lot of our students, is that to recognize that you know more than you think you do. but you're not as good as you think you are either sometimes. So it's that
Oh
really
my
that's that
God, that
balance
is
of
good
yeah,
advice.
it's just that balance of just humility and confidence, is that you
Mm-hmm.
really have to have that sense of humility and but have confidence as well. So it's finding that line, which I just think is so many students, I think younger people, they just don't think they know anything and they just lack confidence, and you need to have that, but you also need to have humility along the way. So
Mm-hmm. Mm-hmm. Perfect. Jen, how about you?
You're right. I don't think you asked this question
I
in my
don't think I
previous,
did.
but I
Yes.
like it. So I would say, never say never. There's always opportunities, and don't close those doors permanently. And tied to that is take one step at a time. So I work with a lot of individuals who kind of look way down the road and they say, I could never do this, or I could never be in charge of a research program, or get a PhD, or be the lead administrator in a hospital system. And so that's where I say, take one step at a time and never say never.
Perfect. Well, excellent advice from the both of you. And I appreciate you both for coming on to talk about the APTA research agenda. So thank you very much. Thanks for your time.
thanks, Karen.
Thank you.
And everyone, thanks so much for tuning in. Have a great couple of days and stay healthy, wealthy, and smart.